So this is the digitisation of public health messaging in community pharmacies. For those who don't know, a big part of the role of a community pharmacy is promoting healthier lifestyles to members of the public. We're commissioned to do 6 campaigns every year, and those campaigns are based mainly on leaflets and posters at the moment. So the idea behind this project is to take those paper-based campaigns to turn them into something digital through the installation of a commercial display in a pharmacy. What we've planned to do is run some really engaging videos on those displays that can promote not just one message, but many messages to members of the public in a really kind of vibrant and attractive way. The AHSN have been instrumental in helping this idea become real. So we've had this idea, or I've had this idea for a number of years now, so getting on for 4 years. It's just been kicking around, and I have been talking about that idea with colleagues, which is an important thing to do, to test that idea, to get feedback on the idea. But just recently, when we were in a meeting with the AHSN, we talked about the idea. It fit with some of the AHSN's criteria around innovation, particularly in digital. And that's a really good moment when somebody's looking for ideas and you've got an idea that fits, you can come together, and we took it from there.
We originally got a project initiation document from André which outlined what he had in mind for how the project would go and how it would roll out. So the AHSN, we just supported that, and we brokered those introductions to people within industry and helped them develop an expression of interest, a specification. There was also the expression of interest to get the community pharmacies on board, so people would say whether they wanted to join in on the pilot, right down to going out for tender or a mini tender, so to speak, for the screen providers, developing that spec and then eventually roll out an installation of the screens. We also helped with the conversations with the evaluator for the project, because we highlighted that there needed to be an evaluation for this so that we can take it on further past the point of this pilot.
The content and the screens combined, it revolutionises how the pharmacy promotes its messages to members of the public. So whether it be opening hours, or whether it be the flu vaccinations, or whether it be sexual health services, or even just general messages about lifestyle choices on diet, exercise, it just provides a whole new information source for people visiting the pharmacy. And we know we've got a large footfall in the pharmacy, so I guess when we've been speaking to pharmacy teams, they've received these screens really positively. For them, it's brought the pharmacy up to date. Using leaflets and posters, I think, is kind of last century really, in terms of the ability of those leaflets and posters to reach the audience. And this is just bringing the pharmacy up to date and making it current. We've installed the screens in 20 pharmacies across the northeast of the country. We've run the evaluation, and the evaluation's been written. So we've had some really positive feedback from members of the public, volunteers who have gone in to see what they thought of the screens. We've had some positive feedback from pharmacy teams, and of course the project teams inputted as well. So the evaluation's been written, and I think it's a really strong evaluation. So I guess the phase we're in right now is promoting the results and the findings of our pilot program. And yeah, we're looking to spread the word and help others understand what these screens and what digitising public health messaging could do for pharmacies across the country.